Hello, viewers. My name is Eddie Kainda. This is ACFIM Talks, and this is Alliance for Finance Monitoring. You are welcome here to another version of ACFIM Talks, and my name is Eddie Kainda, and I'll be your moderator for today. We are joined by Michael. Michael works with CSBAG. Michael is an economist with over 7 years experience in research, public policy development and implementation, fiscal and economic policy management. He's also a specialist in project management and currently works with CSBAG. CSBAG is the Budget Policies Civil Society Budget Advocacy Group and is a budget policy specialist. Michael, you are most welcome to this show. And we are really looking forward to learning a lot from your expertise. Michael, please say hello to the viewers.
Thank you very much, Eddie. The name is actually Mitchell. It's Mitchell Ainebyoona, and I am glad to be here. I greet you, viewers, and those that are listening in.
Thank you, Mitchell. We shall be joined in by Honorable Karuhanga. Mr. Karuhanga is joining us. Honorable Karuhanga is joining us anytime, and I think he's having challenges connection, but anytime he will be coming in. Before the show, the major topic for today, we are trying to analyze supplementary budgets. Remember that we're in the era of COVID-19. We're tracking supplementary budgets in the COVID fight. You recall that government of Uganda has approved 600 billion shillings to fight COVID-19. Remember that we have been battling the scourge of COVID right from 2020 up to now, and there are many issues that are coming in, and there are many issues that are in the public domain that we shall be discussing. But before we go that far, there are a lot of issues that are trending out in the public. You shall recall that other than the supplementary budget that has been approved for 600 billion shillings, recently, I think yesterday, the president, in his capacity as the appointing officer, approved a list of permanent secretaries in the various departments and ministries. And notable amongst those is Minister of Finance, where we have Keith Mkahakanizi being transferred to the OPM, but also Ramadan Gobi, now the new permanent secretary for the Ministry of Finance. I think that is a major change. Secondly, we have appointment of Betty Kamia as the new IGG. Many people are having agitations about that, but we shall hear comments from you. It's a trending issue today. We have the PLE results coming in today, and you shall recall that these are the COVID candidates. Today we are trying to see the justification of government allowing us to have learning from home. Remember the learning packages the Ministry of Education was giving us for the children at home. Candidates at primary 7 are having the results today, and are looking forward to seeing the performance amidst the COVID pandemic. We also have the issue of parliamentary committees coming in. We have several committees that have been lined up. We have the committee on COSASE committee being led by Honorable Senyonyi. We have the Human Rights Committee being headed by Fox Odoy. We have the PAC, Public Accountability Committee, being headed by Honorable Segona. We have the Roles and Privileges Committee being headed by Honorable Katuntu, Dr. Kefa Chiwanuka. These committees are important to us as Ugandans, to us as the economy, because they drive transparency, they drive accountability, and to ensure that public monies are accounted for well. But even other sectors are performing perfectly well. Yes, as we come in, Mitchell, as Mr. Karuhanga joins in, we shall recall that Article 156 of the Constitution of Uganda and Section number 25 of the Public Accountability Public Management Act requires us that we can always have supplementary budgets. Remember that supplementary budgets for public knowledge, monies that exceed what has been budgeted, and government has always come in several times, probably at the end of the budget quarter or within the financial year, to have additional monies in addition to the budget that has been approved by government. But for purposes of learning, Mutual, I would want you to indicate to us, what does a supplementary budget mean to the common person? Mutual.
Thank you very much, Eddie. Like you've noted, first of all, I would like to paint the situation that we have been in as a country and where we're coming from.
Yes.
You have to note that governments all across the world have been affected strongly, especially socioeconomically in this period of the pandemic. With the government lockdowns and restrictions, it has affected business activity. So the context that we are coming from is, remember, we have been in a year of elections that have greatly distorted parliamentarian processes. We have a growing public debt at hand. We are close to the threshold of about 50%, I think. As of June 2021, the projected figure was 49.9 as of June 2021. We also see a reduction in revenue amounts by URA close to 2.3 trillion, at least in the previous financial year. And this is when the scourge and the growing infestation of the COVID-19, especially the second wave. So out of the elections, here we are overwhelmed. This is a lockdown, livelihoods are at stake. That's where we stand as a government. So quite a number of economies around the world have experienced this. And it should be said that we have not entirely been hit by surprise. These are discussions that had been seen before. Around India, we had known that the India variant was bound to come through. We knew that the second wave was bound to be stronger, but nevertheless, government was a bit hesitant to take measures. And as such, these are some of the things that usually inform supplementary budgets. As a country, we have a history of supplementary budgeting that is not very, very, very good and popular among the public. On average, if you look through, you'll find in a particular financial year, we table supplementary budgets about 5 times.
What does
by law, like you've stated,
what does that mean? Does it mean that the government had wrong priorities? Why do we have supplementary budgets just in the middle of a year, for example?
Yes, I would say partly, I'll put it out right. It's budgeting discipline. It's planning in discipline, really. And the reason why is that quite a number of agencies, they benefit from tabling supplementary budget. It's an avenue for avoiding scrutiny by Parliament. Like I've told you, we were in a period where Parliament was bound to be, dissolved in preparation for a new one. So there wasn't so much scrutiny. Most agencies usually use this opportunity to table supplementaries because they don't usually go through the rigorous process of scrutiny and vetting by Parliament and the responsible authorities. So quite a number of funny expenditures can go through in this process. That's why it's something that even if they know, quite a number of agencies knew. Ministry of Health knew quite a number of these things. The Ministry of Finance knew quite a number of these. The local governments knew because they're at the forefront. But why didn't they plan in the process? Because there are discussions of taking the budget back and realigning. Why didn't they do this? So it's an avenue, it's a popular avenue that many agencies benefit from if not checked. That's why usually it's a popular thing. Yeah, so by law, it's given, like you've stated, Article 156 of the Constitution and Section 25 of the Public Finance Management Act that was amended in 2015, that there will be a provision for a supplementary budget.
If I may ask, towards the end of the
exceed 3%.
Towards the end of the financial year, we saw the current approved supplementary budget being passed right at the end of the financial year. Now, and we know that this budget, the budget for this current year, is about 44.7 trillion shillings. What does this mean? Where does this money come from? Does it mean that some of the monies that are supposed to be done for other activities within the budget have been cut, and we are looking at this money as extracted from the previous or the current budget? or are we looking at money from another source being brought in to act as a supplement to the previous or the current budget? What does it mean to the common person?
There are various ways of financing the supplementary budget. One of them is through budget support. Sometimes we can get relief monies, and a portion of that is sent for supplementary expenditure. For example, in 2020-2021, the supplementary schedule presented a supplementary budget of about 1.3 by law, the 3% of the 45.4 trillion. Of this, there was a particular amount that was allocated to supplementary expenditure. It was about, I think, 223 billion. That was, if I am correct, I'll confirm that figure. Then the current one, for example, 2021-2022, has been picked from the budget. They just did reallocation, picked monies from some of the expenditures that they think they don't need, things like travels abroad, workshops, seminars, and were able to collect about 600 billion. So it depends on how the government is standing. If it's from budget support, they can also allocate it to the supplementary budget. Government within itself can also fundraise for this amount of money.
Thank you. Mucho is Ainebyoona is the budget policy specialist of CSBAG, and thank you, Mucho. We are tracking the supplementary budgets in the fight against COVID-19. Now, going back to that 600 billion that has been approved as a supplementary budget, you recall that we had various allocations. The local governments got about 8.1 billion shillings. Then security got about 50 billion shillings, and then Ministry of Health got about 206 billion shillings. The rest of the monies government says is trying to allocate for sources of that financing. But for me, my question goes to allocation. Why are we looking at government spending a significant chunk of the money into enforcement and security than taking this money into the most feasible benefits that would help the persons either affected or if affected by COVID-19, like health, like financial support, among others? Why are we looking at government prioritizing enforcement against the common social services that people would need, according to you?
Thank you, Eddie. I share the same sentiments when you look at the schedule. But before we go there, I thought we should first paint the context, because the discussion is on tracking supplementary budgets in the fight. Why don't we first paint and see how the previous ones have done? Auditor General recently released a report in Feb 2021 of this year, highlighting a few areas of how particularly COVID supplementary monies had worked and had been utilized. He noted quite a number of things that I wanted to bring to your attention before we now get into what has been. Because usually what has been informs and helps us better plan of what they're planning, and even, encourage them to do better. If you look at that report, and it's public, he titled it the Thematic Audit Report on COVID-19 Pandemic Government Interventions. He was looking at the monies that were particularly allocated to COVID-19 that were causing a stir in Parliament recently. If you look at that report, usually we're known to shoot down government, but there are some good things that they tried to do. I remember the PSST came out and issued guidelines on how this money should be managed, and quite a number of entities made an attempt to follow. One of them was in his report, he says about almost all the entities took time to prepare and had their work plans approved in the right ways. That was a good thing that I think they can take on. Previously, it's something that they usually do hurriedly and just send because of the little level of scrutiny. Here, at least most of them had. That's something I think we can take on. Secondly, there was full quantification and implementation of the planned activities. They were well quantified, and the implementation plans were well drawn of what they were going to do. Like, Uganda is quite good at planning. The question of how they implement is the other one. So we saw that report indicated about 94% were both fully quantified and implemented as planned, according to his report. And that's a good thing to begin with. Looking at the point where they could have fallen short, and these are quite a number. There were a number of cash donations, remember, in that period. We had people, philanthropists who came and gave and supported, and I remember the PSST giving clear directions on how this money ought to be used. If cash donations were to be banked directly to the national collection account, remember. In the report, if you look through, quite a number of monies were utilized at source, about 0.58 billion. You'll find funds that were not accounted for as of this audit were about 1.3 billion. You will find funds that were not utilized were about 6.68 billion. Not utilized. They have asked for the money. They have very good plans. But because of the government maybe inefficiencies and the long procurement processes, they were not able to. About 10 billion was diverted from what maybe it was meant to buy this, then it was diverted elsewhere. Finally, point out, non-compliance of the procurement processes were totally not followed as guided by PPDA. And these were about to a tune of about 143 billion. So these are all questions. Before we get into now what they're allocating, how have they managed this? So that's a picture that I wanted the public to know in terms of how they have utilized. If I would go deeper in that big amount of the 143 billion that was as a result of non-compliance with procurement provisions, you find that the largest proportion in his report, that report that I'm referring you to, of the mismanaged COVID funds was related to non-compliance of procurement processes that had been put in place. You'll find, for example, about 4.8 billion was as a result of use of inappropriate procurement methods. They don't go through the right ones. You find about 239 million bypassing the contracts committee. What's that called in simple terms? I will not know how to say it here, but you understand what that means. When you bypass the contracts committee. Then the final one that really hurts me, exactly, failure to justify the use of direct procurements. Remember, I told you some of them didn't have to take the money to the bank. They procured directly at source. There was no justification according to the Auditor General.
Probably so these are things they think it's an emergency in any case.
Yes, nevertheless, the provisions for an emergency are also put there. They are not as tedious as the usual procurement processes. It's known. And this is why I mentioned earlier that quite a number of entities look forward to this because of the level of scrutiny that is in. So those are some of the highlights that I thought you should know before we move into this. Now, going to the 600 billion. Going to the 600 billion that you've raised, again, given where we've come from, it also raises questions. If you look at the schedule that was shared by the Ministry of Finance recently, I think they released the schedule on July the 6th of this month. Cabinet approved about 600 billion, like you've stated, of which 371 was to finance particularly COVID interventions under the various institutions, like you've pointed out.
Security, local government, and Ministry
You'll
of
find
Health.
Office of the President had about 6.9 billion. Ministry of Defense had about 10 billion. Local government had about 914 million. Ministry of Health about 197 and the like. And finally, something that we have been calling government on, the contingencies fund. This is a fund that is very critical in such times. Finally was operationalized. A tune of about 228.3 billion was allocated to the fund. This is a fund that's supposed to help us as a country when unforeseen circumstances happen to us, that we can go there, withdraw without stressing or pushing for supplementary budgets. If we had a contingency fund in place, there are some things that we would be able to do, at least get the initial set of vaccines, for example. Pick the initial set of testing kit, pick some money for the vulnerable groups without having to go through the scrutiny of Parliament to have supplementaries approved.
Micho, you point an issue here which I want you to clarify. The ministry, the PS for the Ministry of Health is under the spotlight. Recall during when she was put to task to account for the monies that Ugandans collected during the first phase of the COVID pandemic. Remember, the public came out to give a lot of money, and she was giving different figures. Is it 29 billion shillings collected by the public? But again, the chairperson of the same committee, Mr. Katongole, was giving another figure. But also, we are having cases. Diane is now replaced as the PS for the Ministry of Health. You are aware of that. Amidst public outcry that she has grossly mismanaged the the COVID funds, including what has been allocated. Now, you remember the 400 beds that they were supposed to procure for the hospitals and many other things. Now, when you look at a sector that has actually been put in the public outcast for mismanaging funds, but again, you're allocating more monies in the same ministry under the same leadership. What does this mean to the sector and in the fight against COVID-19?
Thank you very much, Eddie. Yes, you raise very valid points there, but I wanted to say this, and let it be known that, for example, the Ministry of Finance releases money, and over the years has improved on when it releases this money. And I think by law, they're supposed to release it by the 10th day of the first month of the quarter. And they have already released the batch, for example, for this quarter of this financial year. How that money is used usually, now you don't come to the Ministry of Finance and blame it. It's the entities that I have pointed out in, for example, that the Auditor General has raised. The Ministry of Health, like you've seen, I remember in the previous financial years, they tabled, I think, a supplementary of about, I don't recall the amount, but they tabled a supplementary of the actual amount. Remember, I told you they sat down this time around. Auditor General commended them for really drawing the right implementation plans for their budgets, clearly of what they need. And I remember they tabled a supplementary budget of about close to, I think, 200 billion or something like that. I am not sure of the actual figure, but they only approved about 82 billion. That would mean some of the planned activities and interventions they would not do as much as they are ready and willing to implement. The monies that have been released to the Ministry of Health, you've seen, if I read you some of the schedules, quite a number of them are going to regional referral hospitals to equip them. Some of them are going to the districts to help the health teams that are doing inspection. So yes, the accountability lies with the Ministry of Health. But like I've said, the Auditor General sat down and points out even the actual entities that the Ministry of Health can also bring to task and ask how this money was used. Again, let me highlight some of them. I have pointed out especially procurements which had a lot of money that was misused in the procurement processes. Close to about 143 billion was mismanaged. Why? I pointed out some of the things. Inappropriate procurement methods. Those ones the Ministry of Health cannot come through to really look at. Diana really cannot come and look at every one of them. It's incumbent upon the implementing officers or the accounting officers at the district level. Bypassing contracts committees, there's not much she can do, especially the Ministry of the Secretariat, So these are the pertinent questions that what measures do we now put in place to follow it up? I'm happy that Parliament lately, especially the Health Committee, has been very keen in scrutinizing this. They're putting people to task, So in terms of how they have tried to manage this, yes, there are gaps here and there, but in my opinion, I think they're still trying to manage it in the way they ought to manage it.
Does that mean that the task is so big to be allocated to Diana? Is she finding it very difficult to have a system that can track? Because if you are the lead accounting officer, you ought to ensure that you have a pertinent and particular system to ensure that these monies are followed and used perfectly. You recall that at some point, even the president gets agitated by his responses, by her responses on specific issues, and now she's almost taken to be a public joke, and I'm not sure whether she's happy about this. But is it about systems? Is it about capacity? Is it about operations of the deeper state? What is it that you think as CSBAG is happening?
Thank you, Eddie. You've pointed out the issue that we've always been saying. I told you that one of the things that the Auditor General commended the entities, almost all of them, 94%, drafted and developed very good plans. But the implementation challenges that we have as government, the inefficiencies, I showed you a number of funds that were unabsorbed. I mean, they asked for the money, they gave it to them, but they were not able to absorb it. You get? So the government inefficiencies, in fact, the actual amount of the money that wasn't utilized according to the report was about 6 billion, 6.86 to be exact billion, wasn't utilized. Why? If you look deeper, you'll find maybe some delays in proficiencies of procurement, like I had mentioned earlier. Personal interest, someone delays to pass a particular amount with vested interests that you'd want this money, and it's affecting someone else. So because there are no strong checks and balances, especially at the implementing agencies, it becomes a bit hard. That's why I said that for example, they had the money currently for vaccines, but it's now a bit beyond the Ministry of Health. The vaccines are quite expensive right now, and the claim is that they are unable to get a good deal on the market. If they go ahead and procure, they will still be brought to table and asked, why didn't you follow this? So in the guise of trying to follow the stipulated guidelines, they risk being looked at as the public. In the guise of trying to act in the situation of an emergency, they also stand to be scrutinized. So it's a hard rock. I wouldn't want to be in her shoe. That's why I empathize and try and understand and see. Yeah. So mostly it's government inefficiencies within the systems.
Someone would want to relate that as soon as the government approves and delivers the money for supplementary budgeting, the cases for COVID-19 comes significantly low. What is the relationship between releasing the money and the cases drastically dropping to the extent that we now think we're not in an emergency for COVID-19, but the situation is manageable? Are there any underhand methods in such kind of a scenario? As the public may say.
I cannot confirm that. That's public hearsay, Eddie. I don't work with hearsay. I am a researcher. I work with evidence. All the information I'm sharing with you is from government reports. A few of them, my opinions. So if it's public hearsay, I have had that as well. That when they release the monies, the cases go down. There are conspiracies that maybe donors want the number of deaths to increase, But what is known is this. Currently, what we need is vaccines. Without a shadow of doubt.
Because out of the 20 million Ugandans that are eligible for vaccination now, I think only 1 million persons are vaccinated, either fully or partially. And the president mentions that for us to lift the lockdown, we need to have a threshold of about 5 to 6 million Ugandans vaccinated. And we're also looking at significant amounts of money is available probably to buy vaccines, as you mentioned. But also we are looking at the chains in vaccine procurement, delivery, storage, and the actual implementation of the vaccine programming. What does this mean to when can we have Ugandans vaccinated? If I can take you to what happened in Europe recently, you saw I believe you're a football fan, and you saw Euro 2020. I think it's no longer about in Europe. It's no longer fear that they should fear COVID because everybody is vaccinated. You saw the fans in the stadia. They didn't have masks. They're free. At what level are we going to get to that level where we think that we are now safer to operate? Or are we going to think that, okay, COVID has come, people who will die, those who survive will survive, let the world go on? What is your take on that?
The president recently, in one of his speeches, expressed a lot of disgust with our European partners and our implementing partners, especially the donor group, of how when a crisis happens, they will show you where their priority is. Of course, their priority is their populations. They will not sell to you when their populations are not yet away from risk. And for us to pull out of this, we've seen, like you've pointed out, stadiums were full, 30,000 people and above. No one with a mask, almost. They are hugging each other. And the cases haven't even increased. I was also thinking that the cases would increase after those Euros. They are still down, So it has come to attention that there are some things that we will have as a country. We have learned, I hope. Right now, before it used to be the money. We have the money, but we can't access it, Currently, you've pointed out a few numbers here. Currently, it's only about 3.9% of the population above 18 years against a target of 70%. 3.9% currently above 18 against a target of 70%. who have been vaccinated so far. That necessarily means that it leaves the greater percentage of the population at risk. You know, if you look at the cost currently of someone just going for a test, it's between, I think, 250,000 and 500,000. That's a PCR.
I recently took a test at 200,000, and a rapid test goes for about 80,000 shillings.
Exactly. Now, how many Ugandans can access that amount of money, and how often can they do that? Like you can. You see. So,
in the same vein, the Ministry of Health has been put to task to explain why they're inflating the cost of testing. As you continue.
So all those factors have exposed. Partly now, what you raise is what they call. We usually depend on what they call in economics is what they call market failure. It's something that we quickly also discuss, and then you also hear things like government failure. This is when government is supposed, government by mandate is supposed to provide all the public-related goods. So it's something that we are keen on pushing. Government failure. But recently, we've experienced what they call market failure. The markets have failed to work. The private sector has come on board, and these are profit-oriented people. They have raised exorbitant prices, which they have tried to justify. If you notice all the discussions, some of them are beyond them. As a government, have we learned? There are things that, when left unchecked, government used to think that they would pull out and say, no, the forces of demand and supply will manage this and will control this. The prices, for example, they haven't. They have gone so up. You have people locked down. They're not productive. The cost of services are going up. What do you expect at the end of the day? So these are lessons that I think, in my opinion, government has learned. I want to think they have learned, because as we speak right now, there are discussions, for example, of operationalizing the parish development model, all efforts geared towards empowering the productivity of the citizens to be able to afford the services that you're raising. There are services that individuals cannot provide for themselves. Me and you know that, Eddie. You cannot go and buy a vaccine for yourself right now. That one is known. That's a mandate of government to provide. Right now, they have the money. Let them work towards having us get the vaccines at whatever deal possible right now.
Thank you, Micho, for those insights. We shall go in for a commercial break for 1 minute or two, and when we come back, we shall be looking at the value. What value do we get out of this supplementary that has been approved? Why do we see security being put at the forefront other than financial inclusion for the common man? That you recall the Nabanja scenario. Why don't we put that money into the circulation to ensure that the velocity of money increases, so that we can always have demand and supply? But most lastly, we shall be looking at what is the government priority in terms of this, and more lastly, we shall be looking at what is the president saying about this, because everybody seems to think that he is or she is implementing guidelines of the president. Is this how the president does his things? Thank you so much. Get back to you.
COVID-19 lockdown has left us poor. Money from candidates won't make you rich. Do not be desperate. Focus on issues, not money. Often money used in campaigns is dirty money. Do you know its source? Corruption, mafia, drug trafficking, human trafficking, theft from national budget, self-seeking foreigners, selfish businessmen, selfish money lenders. Don't abandon your duty. Elect quality leadership, not big spenders.
Thank you, viewers, for getting back to ACFIM Talks. This is Alliance for Finance Monitoring, and we are hosting Ainebyoona of CSBAG. This show comes to you every Friday of the week between 11 and midday of the week, and we're discussing topical issues at hand, and we're trying to give highlights of what is happening from an expert angle. Mitchell, before we left, we were talking about how these monies have been allocated, how it's been utilized, and you've given a very good insight of what it means to allocate, to implement, but most importantly, the processes that they use to ensure that these monies are make use of what we need. But the key issue here, do we see value in this? And I may give you a scenario that when Madame Nabanja gives out to almost 510,000 Ugandans and they're given 100,000 shillings, but we see lots of money being utilized from the supplementary budget. What key learning are we picking from this? Are we going to keep giving supplementaries, supplementary relief funds as and when we get pandemics, or should we build a sustainable economy where everybody is financially inclusive to ensure that such a kind of thing happens and everybody goes to his own normal businesses, where we find people having economic production units within homes, where people are on their farms, or in small businesses, such that we don't have to worry whether we're going to eat or not. And why is this happening only in urban areas? When you move around the country, persons within the countryside, digging, harvesting, planting, and the whole horror is about urban areas. What exactly should we do to ensure that we do not have a repeat of such a thing? When probably this is not the last pandemic. I'm not a prophet of doom, but more pandemics are about to happen. Should we continue like this?
Thank you, Eddie. And no, you're not a prophet of doom. This is known. We are anticipating the third wave. Fourth, you've had alpha variant, beta variant, gamma variant, and the like. Indian variant. It's not about to stop. That hullabaloo is not about to stop. We have seen it. I mean, the Euros again are the best example. Right before our screens, people are back to life as usual. I think one of the first countries in Europe that has totally banned any COVID restrictions is Iceland. They have banned for them. They are back to business as usual. You should also understand, and the viewers are watching, that remember we have over 3.5 million Ugandans in the subsistence economy, like you've raised. That's usually the euro. Of this, we also have about 8.3 million people living in absolute poverty. There's poverty, then there's absolute poverty. That one that is way beyond that threshold of $1 a day. About 3,700. Exactly, about 8.3. Of which 7 of them are in rural areas, about 1.3 are in urban areas. Now, that 1.3 that you're saying are people who are characterized by hand to mouth. They will go to town, make a living, maybe 10,000, above that threshold of poverty. And you will say, oh, those are not poor. But he will make that 10,000 because of the standard of living in urban areas. Eddie, the standard of living in urban areas. Right now, a liter of milk, exactly, it's not cheap if you're buying packed milk in an urban area. Whereas in the village, you will get it at 500 shillings now. So the standard of living and the cost of living within the urban areas puts more pressure on those who live from hand to mouth on a daily, who I have told you are quite a number. And you've seen they're the ones who are struggling the most. The ways that we've also noticed as well is that we don't have a database for these people. You've seen different lists have come out, and if you notice, they have left out quite a number of people. Your boss was reached out to, they didn't have an updated list. That means we just have an estimate, but we don't know who. This then means that even if you have money for relief, it's not going to reach the intended person. So it's a question of how we manage our data of the people that we have. The previous COVID, we had a list previously. Yes, it didn't work very well, but it's a beginning point. They didn't have to go back to the drawing board to pick the vulnerable. Again, we are anticipating this scourge to continue. What is being done now to enhance that list and update it? So for me, those are the simple, practical questions that don't even need a big budget to be implemented, and they help in relief. You raised an issue of the priorities of the supplementary, and you asked, every time we have an issue, will we run to supplementaries? And ideally, no, that shouldn't be the case. I mentioned earlier that as a country, we have a contingencies fund. A contingencies fund, the law guides, the PFMA guides that 0.5% of the previous appropriated budget is what should be allocated to the previous fund, the contingencies fund. For example, the previous budget was about 45.4 trillion. So 0.5% of that put aside, about close to 300 billion, just put aside. In the event something happens, we quickly pick, we quickly pick and go and address and respond as we are sorting ourselves and realigning the budgets. These are all things and discussions that we've had with the government, but have not been keen to take on. It's lately when the disaster has struck that they have operationalized it. They have put about 228 billion. It's sitting there waiting to be used. Now we're like, does it have to first happen? But we've made a provision in the law. Why aren't you adhering to it? So, Eddie, those are some of the small things that over time we keep on seeing happen, that if tightened, they would make a difference in how we respond to contingencies like the one we are facing.
I'll give you a scenario that when you get 50 billion shillings and you allocate it to security to enforce, especially in the urban areas, between you and me, you know that a hungry person is an indisciplined person. You can never hold a person home, even if you like, when you know that this person is hungry and he doesn't have anything to eat, or if the family doesn't have, by all means, they always have to get a way of moving out. When you go to town, arcades are operating underground, and the same security that is given money to enforce other persons letting people go to the shops and operate. For me, should it be about enforcement by security, or should it be about empowerment of the people to ensure that they can stay at home and do their jobs? And notice probably the money we should have allocated to police and UPDF allocated to local governments and the parish development models and the youth livelihood fund and the circles, and life continues, so that you can grow a bigger informal sector where people can produce and demand.
Eddie, I share your sentiment 100%. We have always been questioning why in these supplementary budgets, you'll find, like the schedule I read to you, if I will just go to it, let me just point out a few of the things. For example, Office of the President is among those, definitely. You have Ministry of Defense having about 10 billion. You have Police Force, about 19 billion of that 600 billion that you've talked about. ISO, that's Internal Security Organization, having about 4.7. ESO, about 1.1. That's way more than the referral hospitals that are at the forefront right now. Arua, for example, regional referral, has been allocated, almost all those regional referrals have been allocated a similar amount of about 575 million. Almost half of what they're giving to the security organizations. Look, if you've been following the priorities of the current government, if you remember the 10-point program, the president was very clear in his priorities. What was number one? If you recall very well, security. On that one, he's not willing to compromise. And he said it publicly, said, matters of security, that one, we cannot compromise. And people usually ask the question, are we at war as a country? Yes and no. If you call security experts, because look, the president is one of the people that consumes the highest amount of intelligence. And he cannot come out to explain why they're doing certain things. You've been seeing the insurgencies that have been happening internally, that bring scare in the public. The argument is that without security, no economic activity can happen. If there's instability, nothing can happen. That's a priority that, from the experience the NRM has had, at least in my opinion, that they are keen on and not relenting to compromise with.
Of security.
Currently, however, health is what is a priority right now. It's at the forefront. Health does not work alone, Eddie. All the entities that you've seen up there work hand in hand with health. There's a level of enforcement. Me and you know, currently there's a lockdown, but Ugandans are moving. Who will enforce that? It's the enforcement. So they need that. The district task forces have to move around and the health teams to enforce. A lot of controversy has been in Masaka recently, with the RCC being very hard-handed. on the citizens. Why? Because they're not heeding. And the Ministry of Health keep on saying, if you stay back home in a space of this period that we have had, we should be able to reduce the transmission. Until the transmission is high, there's need for enforcement. And enforcement is costly. Me and you know that. The feeding costs, there's what they call special meals if you go deep. And maybe the other thing that I didn't point out was, if you look at the supplementary schedule, it's too generalized. It doesn't give the detail. If you look at money is going to State House, you will not know exactly how much. In the previous supplementary budget of 2020-2021, about 201 billion was released for State House. 200 billion of that money was for classified expenditure. How would you scrutinize that as a member of the public? So
that's why my question is, can we justify that amount of money against financial inclusion from the economic perspective? You're an economist, you know, force of demand and supply of money, and among others. When I have my 10 chicken at home, I'll be forced to stay home and look after my chicken than you running after me in the streets that I'm going to look for money. That's the point I'm trying to deliver to you, that as a sustainable measure, that in the next pandemic or the future pandemics or waves or whatever, is that where we should go than investing a lot of money in security and enforcement, so that people can stay home naturally to cater for themselves and their families? From persons who share these issues with the Ministry of Finance, and that's why you're here. Is that where we should go as a country?
Again, I agree with you 100%. You're speaking to the converted. You've seen the star that Nabanja's money has caused.
Yes.
Quite a number of people who are not even on the list for some reason are expecting something.
Yes.
Why? It goes to show you, I gave you the statistics of how we stand as an economy, the subsistence levels that we have. And the thing that the president usually talks, kida kionka. Someone makes money or grows beans to be consumed, not taking any to the market, you know. The efforts that are being done right now by the Ministry of Finance and government at large, one of the best things that we have applauded is that parish development model. I know there are pessimistic people there who think it's like any other thing that will not work. The Ministry of Finance this morning was having a meeting to see how they can roll out that 200 billion that was allocated. It's more of a revolving fund, you know, that will now bring money to someone's pockets. The thing that you're now talking about, that he will have his projects, because they have zoned it out. It's now a scientific method that they will go to Busoga, find out what thrives in Busoga. They'll go to Ankole, what thrives, give them the inputs required for that and make the investments. That when the person has the chickens that you're saying, he will not be tempted to move around, look for livelihoods. Every household will have the ability to have some money. And this in economics has what they call a multiplier effect in the economy. If you start seeing money is now growing within the informal sector, then URA now will start to see or find ways of how to bring some of it to the treasury. So without a doubt, to begin with, there has to be vaccination before people can be allowed to move, because you have to be alive to enjoy the money to begin with. Government, currently, we encourage it to continually strengthen those parish development models, empower and recruit. There's a lot of gaps right now. We have lots of sub-counties or parishes that don't have sub-county chiefs right now. They have to be hired, and the budget has been provided for them. So, in my opinion, yes, the priorities right now are moving towards the right direction. If you see the thinking of government, if you look at the budget of 2021 to 2022, a lot of monies have been put to cascade down than staying at the center as has been originally. So I think they are moved towards that. Ours is now to call upon them and say, hey, this is what we are seeing. Please follow through.
As we come to the end of this show, now, in the perspective of what we have discussed, everybody seems to say, I'm implementing the presidential directive. And this mess you have seen, is that how the president has directed? Do you think the president is happy that my people that I've directed to implement COVID guidelines, COVID funds, COVID everything are doing it that same way? But most importantly, is do we Ugandans get value out of this? Do we think we are getting value for money? We're getting efficiency. We're being effective in ensuring that the monies are being utilized well, and we're having economic value out of this. What is your take on this?
In terms of efficiency, I've already noted a few of the things that have not yet been addressed that were pointed out by government itself. I mean, the Auditor General pointed out quite a number of issues that are as a result of government inefficiencies. To begin with, let me give you my opinion on the way in which some of these restrictions are being implemented, like you've said. I don't think the president is happy with some of these things, definitely. But like I had mentioned, Ugandans are not easy people. Look, someone is frustrated. He cannot, a head of a home cannot sit back at home and just look on when his family doesn't have something to eat. Like I mentioned, in the urban cities, there's a big percentage that I read to you that believes on hand to mouth on a daily. There are areas of rent that they have to meet. Landlords, some of them are being hard on some of the people, you know. There are lots of needs. Some are nakaweres, the newborn, babies have come through. There's a lot of pressure on what you would call your usual family life. So that's bound to get people desperate to flaunt all the restrictions, if not put in check. Like I'd said, if some of this money had found them home, however little it is, let's say this is what government was able to raise to begin with, 100,000 makes a big difference. And it would reduce as government goes back to reprioritize on things that we have raised that we think are not that a priority, in our opinion, In doing that, you're able to keep at least the people in one place, and you're reducing the spread. The curve is going down. There's opportunity for opening the economy for them to go back sooner than later as we wait for the vaccine. Unless that is done, it's hard right now to tell someone to sit back home. Me and you, humanity, it's hard to tell someone to sit back home and starve. You've seen pictures that NBS has been showing. Someone gets to town, collapses because of lack of, it's hurtful. Yet within the villages, there's plenty of food. So you're thinking, are the foods restricted? Some of the food prices have gone low for so you're questioning the mechanisms of transporting some of these, the mobility of what we call factors of production, Has it affected, especially in the urban cities? So all those are areas that we think through that if tightened, like I'd mentioned earlier, the efficiency needs to be tightened as soon as yesterday. Accountability of the funds needs to be tightened, because right now the public is faced with distrust. They're a bit hesitant. That's why you see Diana has been on the limelight that you're misusing the money, however much she has tried to account for it. And I've read you some of the accounts here. But until the public gets something to eat in their mouth or allowed to get it by themselves, this will is bound to continue, in my opinion.
Somebody watching is saying that in the last COVID lockdown, government distributed to about 630 households, but now that reduced to about 500 and 1,107 households in more cities and municipalities created. And the comment is government working backwards, more people getting more, are they getting more affordable means of survival? Why is government working backwards? But in the same regard, is it time for government to start honing for persons to go back in the villages? I was in the village yesterday, and a bunch of matoke is at 2,000 shillings. A heavy band that would go for about 40 or 30,000 shillings, meaning that we have more food, we have more means of survival. Should we start calling for an approach to recede from the cities and urban centers and go back and engage in more productive avenues than staying in town to live hand to mouth? What is your take on this?
Thank you. That's what I mentioned about market failure, if you remember what I said. And market failure usually is corrected by government intervention. Market failure is known, it comes as a result when the forces of demand and supply run out of control, whereby the demand is so much, and when demand is usually so high, prices go up. For example, of healthcare, you've noticed. If the demand reduces, I'm sure those private hospitals will go down. But because the demand is way, way above than the services can provide, prices go up. We have food in this country. Uganda in East Africa has above almost 54% of arable land. In East Africa, the whole of East Africa's land, Uganda has the biggest. Means that we can thrive and anything we put in the ground can grow. Now, is the thing that I asked earlier. How comes, despite the food that we have in plenty, that is going for a very limited amount of prices, is not reaching the urban cities, whereby most of the stress is being felt? Those are questions that now this is where now government ought to come in and give priority to people transporting food. They have tried, they have opened right now, but they don't have control. They've said, we've opened, we've given you permission to travel with cargo. I see some trucks of matoke moving, but where do they end up? If a bunch currently is between 2 and 5 from what would be maybe 20,000, what is being done to keep those prices moderate in the time that we are in? You see? So the supply right now is way more. I saw someone almost throw away their tomatoes recently. And here people are struggling to have something. So that's where government should be identifying and seeing that, hey, there's food in the villages. What do we do? You recall when schools closed abruptly and government directly intervened in the transport sector. They went down, fined those who are charging exorbitant prices because the demand was high. Markets work in a way that if demand is high, prices will go up. You saw buses had increased the prices because the demand was high. Government intervened. That's something that it can always come through for the food to begin with, because what people now want, this 100,000 is food. Open the markets, regulate, come and say the transportation of all those, we are going to give you fuel, some sort of incentive. You will see the pressure that they have now on Dabanja's money will be reduced. Why? Because people now have the money and the food will be affordable, in my opinion. So I think government needs to come in and check some of these systems that directly have an impact on the livelihoods of people.
Thank you, Michael. We have been discussing tracking the supplementary budgets in the COVID-19 fight, and we've been with Mutual Ainebyoona. Mutual Ainebyoona works with CSBAG and is a budget policy analyst. And we've been discussing of how the 600 billion allocated in supplementary budgets has been allocated, but most importantly, the value that we've gotten out of it. My parting shots is that as we move on within the next 42 days of the pandemic, I think it's more important that Ugandans look out for 5 things. One, we should be able to look out for issues that do have avenues for home improvement. Secondly, we should have avenues for having food security within our homes. But we must always have what we call an economic surplus. Have something that you can have in the home and make sure that your home turns out to be an economic production unit. But thirdly, government should come up with interventions of having value addition, but also addressing issues of market failures. But most importantly, everybody of us should be included within the financial economy, where you have something to supply, where you have something to demand, and this demand must be effective from the economic perspective. But most importantly, we tell people that kindly make sure that you abide by the government regulations, and COVID is real. We are not yet out of the pandemic. The pandemic is still on. Please be sure that you secure yourself, secure your families, because the cost of treatment is high. But before we leave, I would ask Ainebyoona to give us his parting shots in regard to this.
Thank you very much, Eddie, and the ACFIM team for hosting me. It has been a pleasure sharing some of these insights, and it's always a pleasure to come and enlighten the Ugandans out there on matters policy. In conclusion, since the discussion has been about the supplementary budget management process, I will have to point out that supplementary budgeting or supplementary financing usually is something that undermines greatly the budgeting process, if not checked. The idea that agencies will sit back and wait for budgets to be approved and then come with clearly defined work plans and budgets for supplementaries where they know they can justify them and they will pass is something that sets us back very many years, in the budgeting process. We have made lots of strides as a government, as an entity, and these are some of the areas we need to tighten. Secondly, the level of transparency in this supplementary budgeting process is also still wanting. How the priorities are decided is something that we still are questioning. We're still seeing lots of money is going to security, yet currently some of the hazards are health related and others, We've seen monies go to a number of very good initiatives, the EMIOGAs, UDB and the like, but we've not seen it trickle down to the person down, meaning that the intended outcomes of what would be relief, we're not feeling it down on ground, because that's the ultimate place. Finally, my call is to accounting officers. The Auditor General's report of 2021 that focuses on how this COVID money has been used paints a very glaring picture on how we manage these funds. The PSST set out and gave guidelines on how this money ought to be used. Quite a number of them have been flaunted by the accounting officers. I call upon you to be prudent in managing this finance. It always comes back. We will always know. The public will always know, and they will reach you. It's something that we ought to strengthen, and it's central in achieving value for money in all the COVID-19 related interventions. For God and my
thank you, Mitchell, for those insights, and for the persons viewing us, please continue following the discussion on Twitter, on Facebook, and Instagram. I remain Eddie Kainda. Until next Friday, thank you so much. Bye-bye.
The monster of money politics is eating up Uganda's democracy. When you take money from a candidate, it means you are feeding the monster. Then you become a part of the problem. When a candidate who overspends on campaigns is elected, he or she will not represent voters but himself. He or she will engage in corruption to recover campaign money. Social services will not be delivered and the voter will suffer more. Voter, let's be wise. Give democracy a chance. Do not sell your vote. Focus on the issue.